The current state of healthcare reform in the United States has not actually had that much of an impact on me and my family. My dad works for Cooper Tire Rubber Company, so he has employer-directed healthcare coverage, and my mom works here at the University of Findlay. It's a private institution, so she also has employer-directed healthcare coverage. Under her coverage, the rest of my family is also included. It's myself. I have a younger sister who's 20 and an older sister who's 26. Since I'm considered a dependent of my family and I'm only 24 years old, that's why I'm still covering my parents' healthcare insurance. So I still have a few years until I will experience the effects of the healthcare reform. One example of someone who's related in some way, shape, or form to my family is my brother-in-law. He's 27 years old. He's from San Diego. When he first moved here to Ohio a year ago, he actually had no health care coverage. He had no job. He did quite a few temp jobs while he was here, including working for Cooper Tire as a part-time security guard, but he was never offered any actual health care coverage benefits. For a while, he was considering getting some health care coverage, but it wasn't until just recently that he actually got a bronze plan through the ACA. He told me that his premiums per month are about $250, which his deductible then is $5,500 per year, and his out-of-pocket costs max out at $6,400. Considering that $250 a month for someone who only makes $25,000 a year is quite a lot, he said that the impact on him and my sister's lifestyle has been quite a heavy burden. When you take the $250 a month and only $25,000 a year salary, that equates to about 20% of his income going to the premium costs. Someone else who's close to me that was affected by the healthcare reform is my girlfriend's family. Her dad quit his job about a year ago, and then he entered a new position, but he was soon after that terminated for attending an interview with a direct competitor. After doing so, he had the option to either continue his coverage at $1,000 a month, which also covered the rest of his family. He has 2 daughters. Or he could drop his coverage altogether. Given that he has a lot of health problems, he chose to continue paying his $1,000 premium per month for about 6 months. After that time, he decided that he was going to drop coverage, so my girlfriend's coverage was also dropped at that time. When she went to find a plan, she found that she didn't have any employer benefits because she's a student here at UF, and she since she doesn't work full-time, she only works part-time at her job, she wouldn't be able to receive benefits through them. So when she actually got a plan, she found that her coverage was affordable, but the benefits that came along with her coverage not quite adequate to what she wanted. So she ended up contacting her mom and then being added to her mom's plan because she's only 22 years old. So she'll have that cushion between 22 and 26, and she's actually now dependent of her mom. She'll be moving to Cincinnati to be there in order to receive her health care coverage. Now, although the impact of healthcare reform on me personally is nil, in the 2 examples I gave you that are close personally to me, this is my buddy Dave here, and I'm just going to ask you, how has healthcare reform affected you and your family?
Well, I'm still on my parents' insurance, and from what they've said, nothing's really changed at all. I will be covered by them for many years yet. I know that changed. But other than that, they haven't really said anything. They're bringing home more money than ever. So that's really all.
So it looks like Dave and I are in the same boat when it comes to healthcare reform, since we don't quite meet that 26-year-old deadline yet. Although my girlfriend and my brother-in-law are affected, neither of us are affected at this time. So here in a few years, we'll get to experience what it's like to go through the perils of trying to find health care coverage in a state of reform.